my network. Do you want to connect?
It was so wrong.
Right, well, we're after 6:30, so I think we'll get underway. A warm welcome to everybody this very warm evening. Hopefully the temperature's okay in here. But welcome to this meeting of the Overview and Scrutiny Committee. My name is Councillor Richard McMillan and I am the chair of the committee. Before we start, just a few housekeeping matters. I understand there are no planned fire alarm tests this evening. If you hear the fire alarm, please leave by the nearest fire exit and make your way to the agreed assembly point, which is at St John's Churchyard off Druid Street. Council security staff will be available to direct you. The public toilets are located off the main reception area. Please switch your mobile phone to silent whilst in the meeting room. Also, please note the meeting is being live streamed to the Southwark Council YouTube channel. A recording of the meeting will also be viewable on YouTube after the meeting has ended. Next, may I remind members to raise your hand if you wish to speak, and please wait until I give you permission to speak before contributing. Furthermore, when the chair speaks, other members should stop speaking and not interrupt the chair. Members can ask questions on the issue under discussion, and members can move recommendations on the issue under discussion. Members of the public are welcome to record, screenshot, or post the public proceedings of the meeting. A copy of the Council's protocol for reporting and filming is available on the Southwark website. Thank you very much. So we move on to the agenda business today. Firstly, apologies. I received apologies for absence from Claire Williams, co-opted member representative for the Roman Catholic Archdiocese of Southwark, and Martin Bracknell, Church of England Diocese of Southwark representative. Are there any more apologies for absence? I don't think so. Great. So we're obviously a newly constituted group. So perhaps voting members would introduce yourself when I call your name, and also just say the ward that you represent. I'm Councillor Richard McMillan, Surrey Docks. Let's go on to my right.
Councillor Victoria Mills, Peckham Rye.
Councillor Stephanie Crime, Rotherhithe Ward.
Councillor Bill Williams, Champion Hill.
Councillor Sarah King, Champion Hill. Councillor Eben Lakota, Oakham Road.
Councillor Graham Nelson, Jules.
Councillor Dean Peters, just Peckham.
Councillor Callum Fowler, St Giles Ward.
Councillor Ryan Cox, Peckham.
Councillor Rachel Penny, St Giles Ward.
You have to sort of lean right into the.
Get used to it.
Thank you very much. Can you still hear me? Speak again. Okay, let's test. That works. Can you hear this? Yep.
Yep.
Good. Item 2, notification of any items of business which the chair deems urgent. And we have supplemental agenda number 1, hopefully you've all got, which contains a correction to the committee membership document. So here we're to note the committee and commission memberships as of 12th June 2026, following amendments to memberships received after the 28th of May 2026 OSC meeting. And that's on the Housing Scrutiny Commission membership. Councillor Helen Benavides replaces Councillor Graham Neal as the Liberal Democrats.
I think you this one here, and you did the. Yeah, you don't have to go down. It's just.
Right. Apologies, so we'll do that item 5. So do I just go straight to 3?
Yeah, just move it out this way. So that we know that it's-
There is one late item of business which is in relation to scrutiny arrangements for 2026 to 27, renaming of a scrutiny commission. And this has been circulated in supplemental agenda number 2, which hopefully you've all got. So moving on to item 3. Does any member wish to declare an interest or dispensation in respect of any item on the agenda? No, thank you. So we can move on to item 4. So can we approve, firstly, as a correct record, the minutes of the meeting held on 28 May 2026? Are those approved? Question?
Thank you, Chair. Oh, is that working? Is that working?
Have to leave.
There's a volume button on the side. Try that.
Is that working? Is that working?
No, not really. It's crackly.
Is that working? Not great. Okay. Chair, I wonder, given that there was a shared understanding by officers and members at the time of the meeting on the 28th of May, that kind of appointments of scrutiny commission chairs were expected to be members of OSC. I wondered whether it would be helpful to make sure that that is explicitly in the meetings from minutes from the 28th of May.
Can you repeat that?
That will work.
Hello. That one is. This one is.
Does that? Yes, actually very loud. Okay. So I was wondering that given that there was a shared understanding of officers and members at the time of the meeting on the 28th of May, and the appointment of scrutiny commission and the scrutiny commission chairs were expected to be members of OSC, that should be explicitly noted in the minutes given later items this evening.
I think that's
very much luck with the mic. Yeah.
Swap this one out. You can have this. If you just want to get rid of one of these and then swap them around. Yes.
No, it's this one.
It's
It's
this
one.
I think it has to be collaborative. Just check maybe.
It's not going.
Jake, it's not where you're at.
Oh, it is now. Sorry, yeah.
No.
Hello.
No, Jake.
I'll go for the speaker. It's going to be in the live stream.
Right.
Yeah, it's just that the speaker doesn't.
You have to speak loud.
So I should give them that. Yeah,
Share that.
just being shared.
Can you hear me? You can hear me. With that item, with that issue, I think we'll have to get back to you on what was the shared understanding. But there is obviously the item further along where we're talking about the chair and vice chair of the Housing Scrutiny Commission's perhaps.
Oh, I think I've lost mine now as well. Well, could we, if you're going to get back to us, could we not take a vote on the minutes until you've got back to us?
No, we'll still be taking. Well, we can take a vote subject to that.
When are you planning to get back to us?
I'll have to check. I'll try to do that.
So could
We
we
can
not?
come back to that.
We come back to the item.
Yeah, we'll do the
later.
other items, come back. Yes, Councillor Cox.
Apologies, I can ask for clarification, could I, from the member on just where in the minutes it's that understanding that a member must be part of the OSC to be a chair? I can't find that in the minutes.
I think that's the issue that they think it should be
I
in the
see.
minutes and whether it's appropriate to put them in or not. Yeah. Well, we know what the Constitution said, it depends what it said in the meeting.
Basically, something missing. Double check it. Bring this minutes back again to the next meeting for approval. Does that make sense? If you can't, you can't. But then we can start recording another.
So on the minutes, I can speak that. On the minutes, Amit will check those and then we will have to approve those at the next meeting, but it doesn't affect the vote that comes later. Okay? Right, so that's noted then. Yeah. To the minutes of the next meeting. So, oh, it's back on. Right, so we move on to item 5, committee and commission membership. And this comes back to supplemental agenda number 1. So for this item, we have a document to note the committee and commission memberships as of 12 June 2026. following amendments to memberships received after the 28th of May 2026 OSC meeting. So if we can note the membership. Please note there is a correction to this item in supplemental agenda number 1, which, yeah, so just to note that, which is clear in the document. Okay, so that's noted. Okay, so we now move on to a presentation from South London and Maudsley NHS Trust, providing an update on activity following the outcome of their CQC inspection as per their request. And so we've got a 20-minute presentation followed by questions. Have we got the attendees? Very warm welcome to you both. Thanks very much for attending today. Maybe you'd like to introduce yourselves to the committee.
Thank you. I'm Professor Derek Tracy. I'm the Chief Medical Officer of South London and Maudsley NHS Foundation Trust. I'll probably be providing more of a strategic overview on larger organisational issues. I'll ask my colleague who will be doing more of the detail of the Southwark specific.
I'm Keith Ajibwe. I'm the Service Director of...
Thank you.
I'm Keith Ajibwe. I'm the Service Director of... I'm the Service Director for Southwark Services in South London and Maudsley NHS Foundation Trust, but for 18 to 65-year-olds. So my scope doesn't cover younger children or older adults.
Thank you. Very warm welcome. So if you've got a presentation, you can take us through that.
Okay, so hopefully I won't have to go through all these slides in details. And hopefully 20 minutes as well. It's just for us to also have discussions and take questions as well. So this is regarding the visit of the monitoring body CQC to our trust last summer, where they picked up issues around how we run our services, around patient safety, in area of our forensic services, which is a trust-wide and national service. We are rated as good. Adults of working age in the community requires improvement. Acute adult of working age requires improvement. Crisis adults requires improvement, and well-led of the organization requires improvement. So in terms of Southwark specific, we are looking at our inpatient wards, and we have a service called the Place of Safety, which is based at most of the hospitals. It's also a sort of run service, always a trust-wide service, but also the arm of the organization that looks after bed management. So all the services were visited by the CQC when they came in summer last year. So in terms of issues that were picked up in the visit, the seclusion rooms where our patients can be looked at when they're very unwell and agitated. The documentation was found to be inadequate, so more needs to be done around clarity on patients who are secluded. There were issues around when patients are on enhanced care. So what that means is patients are one-to-one or being observed closely because of the risk they pose. So again, around that, the documentation around that and the frequency. Also, there were issues. Care plan of our patients. So the care plan hopefully understood as what we're doing as intervention to look at the patients when we're looking after them. How centered it is on each individual and how we involve the patient, family carers in this care plan. Emergency alarm system, again, around the organization. Privacy and dignity for our patients. Again, other things around that we should be doing differently. Risk assessment and documentation of risk assessment. Now, around our staff and our workforce, mandatory training of our staff to help them to have the skill and competence they need to do their job. The compliance is not as much as we would like it to be. Restraint documentation, similar to seclusion group documentation. So when we restrain patients, we normally document details of what happens, who is holding one arm and one leg and where they are. So very detailed so that if there was any incident, we can do a thorough investigation. So medication documentation as well around patients who are given medication which is as required rather than their regular medication. I would document that as well in the patient notes. Physical health checks, where we monitor physical health for our patient that we're looking after, and how do we communicate that to link that with the care they receive on the ward. Waiting times is around how long patients have to wait to access care in the community once they are referred by their GP or from any other services to SLAM. Mental health act assessment delays. So patients who are very unwell that are in the community that needs to come into hospital sometimes can be delayed in the community. And so there were issues around that, and I would manage those people who are waiting in the community at the time. Supervision and appraisal for staff, issues around also monthly rights when patients are being informed that they're on the section, how do we manage this communication with them? Consent to treatment around their mental health act section, and the environment and community teams, somewhere found to be adequate. Then our place of safety, which is again a service business, so that the access to fresh air was inadequate because there was no garden space for this facility. So these are main issues they found, again, not just in Southwark, but across the organization in different boroughs as well, but they all also refer to Southwark. Mark, to carry on. So those are the issues found. Yeah.
Yes, please carry on.
Yeah. So if you just move on to slide 6, which is around the action. So we work with CQC to devise action plan or implementation or improvement plan for the different areas they've identified issues for us, which CQC were happy and signed them off as they will be looking at us, the monitoring of how we implement this plan to ensure that patients are looked after safely. So the very first one, which is on slide 6, is around the place of safety and home treatment team. So these are crisis services in the community. The home treatment team look after patients. Instead of them coming into the hospital for admission, they can be looked after at home as an alternative to admission. So looking at how patients are being supported so that the incident within the HTT is well recorded. In terms of the place of safety, so I mentioned there was no guarding in the place of safety at the time of the visit. So what we've done is we've now started the construction, is the right word actually, of a garden for a place of safety. So that started with this year's capital project for the organization, was prioritized as a project for us in the trust. Improving the compliance rate in mandatory training. So the mandatory training around things around their compliance in health and safety, equality, and how they treat patients. It's also to do with the training in terms of restraining patients as well. So there's a list of the different training. So we now have a compliance of 85%, which is what we're meant to have at time of visit. It wasn't the case. So there is also work ongoing to monitor this training program for staff. Personal alarm for the home treatment team, where our staff who go out sometimes don't feel safe enough. So they mentioned with CQC because the alarm they carry may not be as responsive as it should be. So again, there's been a whole overhaul of the alarm system. Our staff who work in the community use to ensure that they feel safe. In terms of the crisis pathway generally, we've had a lot of work. New services as well are being developed, including the mental health urgent treatment center, which will add to the number of services patients who are well in the community can be looked after. It will also involve a walk-in as well for patients. So all this improvement we've done with our crisis services. Slide 7 looks at our community services, so the issues we picked up and what we've done. So we're looking at risk assessment of our patient and care plans. So we now use Dialogue and Dialogue Plus. We've been using this before, but it wasn't rolled out trustworthy, but now it's fully rolled out, and the compliance rate has increased since we started. So I think we're up to about 70%, and compliance rates we're hoping we're aiming to 100% before the end of this financial year with the rollout of the training program. Then the zoning protocol, which helps us to monitor patients who are unwell in the community, how well they're doing. The zoning got patients who probably require mental health assessment. That means they need to come into hospital all the way down to those who are well. So what we've got now is a standardized protocol where everything follows the same protocol in terms of looking after our patients in the community. What CQC found was some patients, we do not zone them, and we saw that it was related to the caseload of each team. So a lot of work has been done to ensure that every patient who are in the community are zoned and are able to be monitored every day by the community teams. There's also the 132 audits include CTO monitoring. So CTO is a power that allows police and health professionals to bring in a patient without being sectioned. Because in Southwark, especially, we have a shortage of police slots for mental health assessment. What that means is when somebody is unwell and we need to bring them to hospital, police don't have enough slots to accompany healthcare professional to do the assessment. So we're using CTO more, which means we will not require the regular police slots. We can bring patient back. We can record them into hospital without requiring the police support for that. And then finally, which is slide 8, is around the inpatient. So again, looking at the issues identified in the inpatient setting, we rolled out a new system that helps us to monitor. So there's a lot of issues around how often we monitor patients who are under close observation. So patients who are the most vulnerable and well, how often we check on them. Is it every 15 minutes, every 10 minutes, every hour? They do vary. So we now have a standardized approach to that. We've developed a system that we use trustworthy to record and monitor. And this is now linked into most of our electronic system. And we've got trigger points as well to alert when anything goes wrong. The other one I mentioned is biotraffic scales monitoring, which is around making sure patients, even though they come into our services because of their mental illness, there will be physical health challenges as well. So monitoring them is so important. So we've developed new teams that are focused on monitoring physical health, and we work closely with our medical acute trusts like KCH and Lucia. So for us, KCH in front of the mostly hospital to support with health and monitoring physical health. We're going to stop there just to take questions. So there is more I can talk about. I'll expect any area of your interest of us and we can respond to the question.
Thank you very much. That was a very full presentation. I appreciate it. I'm sure there's going to be questions from colleagues. So perhaps if raise your hand if you want to ask questions. Pretty much everybody, actually. Councillor Williams, maybe if we can start with you.
Sure, thank you, Chair. Thank you for the presentation. Can you tell us what the top 3 most significant findings were from the inspection? And also, what's your timetable to implement any of the outcomes from the inspection?
So in terms of the first 3, waiting time in terms of the community, so patients who are waiting, one of our services, which is not sort of specific, had a long list of people waiting to access services. So that's an area we're very worried about. Then the mental health assessment. People who are well in the community will need to come into hospital. But unfortunately, because we don't have oversight and also limited police slots, they continue to deteriorate while they're out there. So that gave us concern. And our place of safety, which is a unit in the Mostly Hospital where patients are brought under 136 by the police. The conditions in there, because of the volume of patients that pass through, makes it difficult for patients to actually have the right quality of care they should be having. So those 3 areas were areas of concern that we had immediate action around those. When I say immediate action, we actually signed them all off and completed the actions, turn things around. So the waiting time, we did focus work and saw everyone on the waiting list at that time in that service. The place of safety, we had again overhaul of the whole unit and change the way we approach care. We reduced the capacity of the unit. We also started using section parts of the Mental Health Act to ensure that patients are treated under the law in the unit. So, I mean, we've got other things we're working on, which are not yet complete in terms of the action, but we have regular CQC monitoring meeting to look at our action plan.
And just to add to Pete's comment, I suppose you can see they cluster to different types of areas from training and documentation, but to add to what Pete said, patient safety will be the area we have to prioritise immediately and make sure on top of. One of the slides mentioned an action plan. What that necessitates is us giving very detailed breakdowns. We've captured highlights. We didn't want to give too much detail, but of course we'll answer any questions. But the response to CQC is dozens of pages with detailing each issue. And to Pete's point, some we can remedy immediately, some require longer time frames, for example, liaison with the police and working with them and so forth. But what we can remedy immediately, we did.
Thank you. As everyone's got questions, I'll move to this side next. Questions on this side?
Sure.
Councillor Peters.
Yes, so this is working now. So some of the major concerns in the CQC report are on the well-led area, and that was a lot to do with kind of management. So one of the points mentioned was the COO kind of had too many portfolios essentially, and that didn't feel like there was sufficient professional challenge. It also mentioned that there's a sense of generally low staff morale, a sense that like complaints couldn't be heard. So this is all quite detailed at the kind of clinical side. Can you speak a little bit to the kind of management's receiving feedback kind of in the staff sort of issues? Thanks.
Yes, and as you may know, what happens is CQC do a detailed inspection of all the services, and at the end of that, the well-led comes out as part of that. So it has staff feedback, and ultimately, the new regime at CQC means that the well-led judgment is what hangs over the trust overall. Clearly, to be requires improvement is not good enough. There are 4 segments. We would expect as a minimum to be good, which is the one above that. Our aspiration will be to be outstanding. I think there's reasonably accurate feedback from staff to CQC at the time. And there are changes which we're undertaking to try and improve that. I think one of the challenges, so back to the earlier councillor's point, some of the things we can change instantly, they're kind of practical things around some of the processes. The well-led piece is a cultural piece, and I think it's going to take more time. A few things we're doing with that. One of the things we recognise is we need to enhance the role of clinicians, so our nurses, our doctors, our psychologists in their leadership positions. So we have clinical leaders, but I think we hadn't adequately empowered them to lead the services. We gave them the responsibility without enough authority to make local changes. The things we're looking to do, one is change the leadership structures of the clinicians. So we will have, for example, I'm a chief medical officer, so I'll have greater direct control over the doctors in the service, the chief nurse of the nurses in the service, working alongside operational colleagues. There was a line mentioned in the slide, it might have passed people by, dialogue. Dialogue is an outcome scale, so what that means is it captures change in clinical condition. and we're moving to emphasize clinical effectiveness. I think one of the criticisms, and I think it's beyond SLAM, although we take our share of responsibility, a lot of the NHS these days is focused on what one might call process management. So the length of time things take, how long till I see you, the number of people waiting to see, and that's really, really important, but it's necessary but not sufficient. And the part that really augments that is safety and clinical effectiveness. So part of our work going forward is having clinician-led standards of care that we will at an operational level lead. So I don't know if you want to come back to that fully answers it, but I think there's a big piece to do that's quite broad in having clinical leaders leading more effectively, and at an organisation level we support them. We have within SLAM, within our executive, we have a group called the Triumvirate, and that involves 3 members of our executives, me as Chief Medical Officer, our Chief Nurse, and then the post you mentioned, the COO, Chief Operating Officer. The 3 of us work closely together in strategically laying out services. And what I think CQC recognised, we have a very excellent COO, I work very well alongside him, but a lot of the responsibility in operational management was given to his portfolio, and the clinical leadership wasn't adequate amounts within the portfolio of myself and the Chief Nurse. I think the COO is very happy to pass it over. That wasn't any attempt by the COO to take that away from us, but it's kind of how organisationally we evolve with time. And so there's some rebalancing of that, in particular because the Chief Medical Officer and the Chief Nurse are the voice of clinicians, the professionals within the organisation.
Do you have a follow-up, Councillor Peters?
Yeah, I mean, so that sounds great just in terms of rebalancing the kind of between the operations and the professional side. Could you give some examples, like exactly how that would play out in day-to-day practice?
We have within SLAM things called CAGs, that stands for Clinical Academic Groups. And we're very lucky within SLAM, as you may know, we have an institute called the Institute of Psychiatry, Psychology and Neuroscience, which is the largest mental health academic unit in the world, actually. So we have great access to world-leading professors and clinicians there. Traditionally, the CAGs have come up with what we would call care pathways, but they haven't been implemented in practice. So they will come out with standards of care. But again, I think operationally, we've been very focused on those process things of length of stay, waiting times, and so forth. What we've started doing now is with CAG standards, we are now implementing them to practice. So a very specific example. I'll try not to bore you too much detail, but to give some specificity. There's a treatment for schizophrenia, a long-acting injectable form of medication. And our CAG has recommended this for some time, that we should be using more of this. And we've had this idea we should do more. What we've done now is we've got the CAG to give us details on case finding the 200 most frequently readmitted people. That's across our 4 boroughs. It's not just Southwark. And we're using our electronic patients data sets to find them and see how many of them we can get on that CAG standard, that long-acting injectable, because our data says the majority of them are on oral medication and not actually taking it. So that's a real direct example of now giving the CAGs teeth, so giving those clinical academics the guidance they set, we're now setting out to measure it. And a specific piece we're doing in Southwark, we also found our CAG recommended looking at clozapine, which is a type of medication for schizophrenia. It's our gold standard by ethnicity, because evidence suggests around the world that people from unorthodox ethnic backgrounds are less likely to be on clozapine. So in Southwark, we ran our electronic patient record, and we found that if you're from a black background, you're 50% less likely to be on clozapine. And we couldn't explain why. And we're now undertaking a piece of work, working with our patients and service center care groups to come up with guidance on how we can rectify that and improve it. So there are probably 2 examples where we're trying to have, you can see they're very clinically led pieces of work, and ones that we would expect would be quite meaningful to patients. And they're quite different from the erstwhile approach of, still important piece mentioned about, for example, getting waiting list times down and so forth.
Thank you. I might just come in there, a couple of questions sort of relates to governance. As a result of this report, which I'm sure a lot of your executive and board found alarming to receive, have you made any changes to your board as a result of this report?
There have been changes to our board. There have been no direct changes as a result of it. So, for example, people having their posts moved or discontinued. Now, what has happened over the last year or so, there's been a natural turnover. We have a new chief executive who will be starting next month in July. I don't know the exact days. And we have a new chair who started about 6 or 7 months ago. And we've had several new non-executive directors appointed. Actually, apologies, there are 2 new non-executive director positions we have been newly created. One is a digital and non-executive director, and going back to the point I mentioned a while ago, we're increasingly using our electronic patient records to what we would call case finds, to not just record information on an individual, but to use data at scale. So that's really important for us, and I think will help improve care. And we have a newly appointed clinical non-executive director, and their role is, as you can imagine, non-executive directors often come from industry and different backgrounds. This is someone with a clinical background from outside of SLAM, outside of London.
Just a couple of follow-ups. You're confident that the new sort of NEDs you've appointed are able to oversee the difficulties?
Yes. So my experience with them, they seem good and competent as involved in the interview process. And they're being tasked with new positions within the organisation that we didn't previously have. Of course, all the NEDs in the past would have had interest in our use of digital and IT and AI and in terms of clinical care, but now having specific NEDs allocated to each of them with core responsibility, I think is really helpful.
And just to add as well, so what we see on the shop floor, if I use that expression, is we see more visibility of our board members, of our senior executives. The next day have regular visits to our services, so we actually feel and see them more. So they're more involved in day-to-day activities on the floor. So that's a change I would say, literally on the ground. Patients and staff will notice that difference.
Great. And my final question is, can you give assurance to Southwark residents tonight that you do have that robust governance in place?
Yes, I would happily say as CMO, I think any large organisation is about 7,000 staff, over 1.3 million London residents, many of whom are in Southwark. I think we have seen significant changes over the last 6 months or so. Although it's not exactly the same, I would just, as an analogy, there's a second oversight framework, which members might be familiar with, called the National Oversight Framework. Around the same time as CQC inspected, we had our national or not oversight framework evaluation, and at that point we were put in sector 3. There are 4 of them. 3 is the third of 4. Since then, because the NOF evaluates more quickly than CQC does, we've moved back into sector 1, which is the top sector nationally. But they don't measure exactly the same things, NOF and CQC, but they are nationally mandated oversight inspections. And so I would say we have demonstrable evidence that care and stuff in recent months.
Thank you. Invite questions again from this slide. Councillor Coton.
Thank you for your presentation. I mean, as you can appreciate, the issue of mental health in Southwark has been a long-standing issue, and obviously to have the prime organisation which is supporting our residents to be at this point rated inadequate, it is quite concerning. I think my question goes to an element of the inspection which raised issues about risk assessment and care planning. And you mentioned some of that in your introduction. And for me, these are early warning signs, actually, that there is there's problems in the organisation in managing vulnerable people. So my question is, can you explain how high-risk individuals are identified, monitored, and kind of supported within the community, and especially across organisational boundaries, because you have individuals with mental ill health, but also have housing issues. How are you working across organisations to make sure that we are supporting them as much as we can?
And that's a really important question, and I picked that up, but then just in a bit more detail. So the challenge we have, so like I said, there are barriers always when you work across multiple organisations. So what we've done, so there's a new zoning framework, so where patients who we know are becoming unwell, we have daily meetings every morning, 9 to 5, Monday to Friday, to discuss them. So what are the issues? What is the risk involved? And then we now go to the police, not just saying we do have 10 people who needs to come in. We've got somebody who is more well than the others and the risk is higher than the others. And then can we prioritize them? So we've got something new around how we prioritize, but also in terms of waiting well, as we call it. So those ones who are in community, they're not able to come in. The amount of support we give to them is also more robust now, ensuring that home treatment team is involved. And then again, the professionals and multi-organization involved. So regularly raising issues with MARAC, for example, that you might be aware of, but also involving the family, the relatives, those ones who are caring for the patient. Sometimes it's very difficult because when the patient is not available or unwilling to come to hospital, there will be steps that we need to take before they can come in. And we know neighbors are worried, families are worried, relatives are worried, but if we don't have the police support we need, it's sometimes difficult. So we just tell the police, can we prioritize this person? Don't worry about the others. So that's something we're doing different, and there's a regular monthly oversight by the trust executive to see how many do you have waiting? So this is from the CQC data, we're doing that differently. How many do you have waiting? Why are they waiting? How long have they been waiting for? What support is in there for them? So every single person waiting now, we know who they are, where they're waiting, and this is what we're doing. So we actually give assurance to the trust exec on why they still are not in hospital. And if we need any escalation at any senior level, they will support with that. So that is different to what we used to do in the past.
Slightly just one thing as a factual point. So we were raised as requires improvement, not inadequate, although that is still not what we'd like to do. What we'd like to be at a strategic level to mention some of the forthcoming changes in the coming year or two, which have started already. We're undertaking a large piece of community transformation, and this fits into a national piece of work. There's been an argument that community mental health teams in the UK, not just in Slam, have been a bit ignored at the expense of more specialist teams over the last few years. What we've recognised in Slam, we've about 240 community teams spread over the 4 boroughs. There's some of them, to Peace's earlier point, might be in very specialist things like forensics or CAMS. And we know oftentimes the evidence shows that risk occurs when people transfer between different services and teams and they fall between the cracks. We're undertaking a piece of work that's consolidating into fewer teams, and we're trying to align with the integrated neighbourhood teams that are forming more broadly in primary care. So what we're trying to do is have fewer teams, fewer handovers. We're trying to link that more with primary care. And the other thing the community model is really emphasising is working with the voluntary sector, with community groups, and having softer boundaries and making sure it's harder for people to slip between the cracks. So I suppose to emphasise, as Peace mentioned, is that kind of tactical bit we're doing now. And then there's the longer term piece of work to try and make the teams more robust into the longer term.
Should I ask a follow-up? Yeah. I mean, it's really great to hear the improvement work you're doing. I think that the term you use, falling through the crack, is my issue. I know you're working on the integrated neighbourhood team, which is, hopefully you're going to provide a kind of holistic support for our residents. But how closely, you mentioned MARAC, how closely do you working with the council? And I know sometimes I think MARAC doesn't really kind of provide that support, that robust kind of collective support. Is there any changes to that setup, and how closely are you working with, for example, the local authority in this area as well?
So MARAC specifically, we do have, we've had challenges in terms of being able to come together to follow every one of our residents. So what we've done recently, so we now have, every MARAC meeting will now have a representative from Slam, Southwark Slam. Not only that, they report directly to myself and the deputy director. If there are any issues, if we identify any particular case that we know is causing concern, it comes to me directly. If there is any, so issues we've had as well as attendance issues. So not just SLAM, but other agencies who are quite important to the care of the patient. So now this comes directly to myself, and we have an agreement with the local authority director as well to tackle this. So we've done that differently now for the past 5 months, and so far things have been going okay. But yes, we did have challenges around our MARAC arrangement, but now we're running it differently, where it's to the highest level of escalation when anything goes wrong.
Thank you. Maybe a question, any questions from the side? Councillor Cox.
Yeah, I had a couple. So thank you very much. Documentation's a very recurrent theme in this. Can you just outline why it was so frequent, and then how are you addressing it exactly? Because obviously you've talked about a couple of times in your actions how you're going to do more documentation, but what does that look like in practice?
So it's important to have details of what is happening when patients are well. And this is to allow us to have a good risk assessment and plan in place, but also to communicate to anyone who needs to know. And sometimes we work with multiple agencies. So if the nurse or the doctor who is documenting what intervention they've had is not detailed enough, that is a problem. So there are standards of documentation. What we get is, because of staff coming and going, you do have staff who will come in, and just because they've had a long shift, what they write is not adequate enough. So CQC found a lot of that. So what we're doing differently is there is a monitoring of our care plans, our risk assessments, documentation generally. So we started that from last summer, where we looked through all the care plans, we looked through also, especially in the place of safety dimension, documentation around why is a patient being held against their will, for example. There's no legal framework. We need to document the detail, why we're doing this, and what is the plan. We're not just keeping them there. So in terms of training for staff, so one of the first things to train staff to make them understand why this is to be done and how it needs to be done. In terms of where it is documented, so it's visible to us. So the other issue we had was there were multiple areas where things have been documented, maybe on paper, but now everything is on a system where everyone goes to as a point of reference. But also there is something around auditing regularly. So we have our patrons and CSLs who, part of their role every week is to audit all clinical notes. So that is very different, because staff are aware that this has been audited, but also they can see the benefit to the patient, but also to them and the care they give to the patients as well.
That's that too. So councillors might be familiar with the fact that we're changing our electronic patient record in staff. So our electronic patient record, or EPR as it's sometimes called, our current provider is leaving the market. So we are obligated to find a new provider, which we've now done, and was recently announced with a system called Real. One of the things we know, to Peace's point, is sometimes the EPRs in the hospital systems more generally quite clunky, and we find that information is duplicated or recorded in places that can be hard to find. When one buys an EPR, it's not just off the shelf. One has an opportunity to help sculpt exactly how it looks. So although we're getting the system real, we're working with the manufacturer for what exactly the product will look like. And we have a group called our CODA, which is our Clinical Operations Design Authority, and that's a group of clinicians from different professional backgrounds across different parts of the system. They're working with the manufacturer to try and make how we record information. The new system will come online in November 27. But when we use that, that would be a more efficient data collection system. I think that to have Peace's points, we know sometimes people put information in, but sometimes it's not intuitive to find it, or information can be fragmented. So we're trying to make the new system as efficient as we can. A lot of staff time can get taken up with the current system, so we're hoping that'll be more efficient too.
Also, just to come back on this, well, thank you, that's really helpful. It's also very useful to find out about the auditing process as well, and that's so important. Are you kind of finding any difficulties balancing that with confidentiality in terms of how you're checking this? Is that a problem at all, obviously, with such personal information?
So not necessarily, because we've got a closed system, which means all record is kept. To get anything outside of the system, we need to go through information governance, like I think most organizations will have it. So in terms of confidentiality, we do have third-party areas that can document. I think it's more of how the system speaks to each other, connect to each other, so that you can get a full picture if you need information about a patient. One of the things CQC was particularly about is, I think Derek mentioned how we do have different areas we record things, how to then pull data out to get a fuller picture. Is something we're doing differently now, but then with the new system, we're taking it to the next level, which means at just one push of a button, you get a clear picture of what is happening to our patients that we're looking after. So communicating properly the care, plan, the risks, in one go. So that's all going. But in terms of confidentiality, I think we're fine. It's just making sure that we at the same time we ensure that patients. So we want to make sure patients also have access as much as they want to their record if they need to.
Thank you very much. Now I'm mindful of time, so I'll take one more question. Councillor Crane.
Thank you. So some parts of the report, there are some areas that are rated good. Are there any best practices of learning from those areas that you can bring to the action plan to those areas that require improvement? And I think the one thing I don't get from this and from the presentation is the risk the risk to patients. What is the real risk to patients when something does require improvement, and how is that managed?
I suppose to recognise one of the things we've done, I guess out of a sense of probity, is we've brought all the problems to you on the list, and the CQC report will find lots of good practice, but we know it requires improvement. It's not good enough, and we didn't want to start with that. There were lots of good areas of practice picked up, and including within any of those areas about risk assessment or documentation. Lots of it is good, but CQC found enough times that it wasn't that they were obligated to tell us that. I'd pick out two things. One is the compassionate care provided by our staff. We're really proud of that, and that was noted by CQC. Our staff were, I think, consistently found to be caring, kind, and thoughtful to patients, and I think that's really good. I think, having said that, I think we often don't learn from good practice as well in the healthcare organisations. We're sometimes trying to plug the leaks and some of the bad things. How does one grow that? That was really good. And I think the second thing taps into that relationship we have with the Institute of Psychiatry, Psychology and Neuroscience, and we're a world-leading centre of excellence in terms of research. Back to the earlier discussion we had, I think what we've not done so far, where we can do better going forward, is taking that evidence base and using that to improve our services. We're literally world-leading in many areas of research and development. And I think one thing we can really do more going forward is using that to set clinically relevant standards of care. They would be two really positive things, and I think CQC said that within the report, and I think we need to grow that. Apologies, was there another part of your question?
It requires improvement. What risk is there to patients?
I think the risk probably comes from the areas that Peace mentioned, and it goes back to what you prioritise. So you've got to prioritise patient safety. So if you've got a waiting list, so this is where I have no objection. The issue of measuring timely care, the process markers, that it's really important. It's just not enough. So what we've been doing is, I suppose, we've reduced that by getting on top of waiting list. The Mental Health Act delays, although as Peace alluded to, some elements are within our control. We can prioritise who we need to do a mental health assessment on. We can only ask partner organisations such as the police and so forth. We have a good relationship with them. So I think those two areas we've got on top of pretty quickly, and I think it is safer than it was. I guess there's perhaps an unanswerable element to how safe. How does one say it's perfectly safe or safe enough? I think things are far better than they were, and I think we have a better system for measuring it than we had.
Thank you very much. Now, I would like just to touch on some practical recommendations from the committee, but if there were any additional questions we haven't got to, by all means email them to our officers, and I'm sure you'll be happy to answer those. But thanks very much. Obviously, our residents will always be concerned about how services are operating. So to that end, would you be willing to share a quarterly progress report with our health scrutiny Commission on how you're progressing against the CQC action plan, so we can see that regularly.
Yes, I think we've last, it's helpful for us to have the relationship with the members as well. And I hope for you to hear directly from us as well as through anything that might put to you advice. So it would be a pleasure to go back.
And in addition, councillors have sort of touched on the importance of sort of working with local authorities. Would you be willing to sort of look at perhaps a working group, a different working group between Southwark Council and yourselves? From my perspective, that actually has the patient voice on, so that we can hear directly on how patients are feeling about the services and their experience of it. Obviously, an appropriate representative. Would you be willing to do that?
Yes, again, I think that'd be very helpful. I think that would be useful for us and hopefully for members and for the public. So I think that sounds like a really good idea.
Thank you. And Councillor Mills?
Thank you. I will send my question in, but it was going to be about whether you'd been required or recommended to come this evening, and whether there were any further requirements or recommendations from the CQC. But I'm happy to put that in writing. I was going to suggest a 6-monthly update, but you've agreed to quarterly, so that's great. Just in terms of how Health Scrutiny deal with it, obviously it's down to them, but I think it would be helpful for them to receive a written update to discuss and prioritise any areas of concern that they may have, they may not, and that be on the understanding that if they do raise kind of questions or concerns, that you are willing to either come back here on the back of that or to go to Health Scrutiny. So I think a written report is a good starting point. We shouldn't expect you to be here quarterly, but I think, you know, if there are concerns raised at whichever committee it goes to, that you're happy to take some focused questions on areas of concern at a future meeting.
We'd be happy to be guided by you. I think part of our response, in a sense, we need to do probably an openness. I think it's important for us where they're failing, so we can talk to you about that. So we'll be guided by you as suits you best.
Thank you very much. Has anyone got any other points, recommendations they'd like to make? Councillor King?
This is a slightly difficult recommendation to make because I haven't asked my question, but I suppose if there is a formal wording we could have about a recommendation in terms of giving confidence to patients and to residents directly. I'm conscious a lot of what we talked about tonight is quite highly technical and in language which I think some of us are actually trying to learn as you're speaking. And so ultimately, while we're the representative of our residents, it is the residents and the patients and the families of those patients that I think need the reassurance most importantly at this point of time. And so a proposal in that space, I think, would go a long way to give more confidence to our residents who are undoubtedly those who are using services or have family that rely on services will undoubtedly be really knocked by the recent judgment.
Thank you very much. Once again, gentlemen, thank you very much for coming.
Thank you.
Right, so we now move on to item 7. Scrutiny arrangements for 2026, the appointment of Chair and Vice Chair of the Housing Scrutiny Commission. For this item, we have a report on scrutiny arrangements for 26-27 for the reconsideration of the appointment of the Chair and Vice Chair of the Housing Scrutiny Commission following changes to the Housing Scrutiny Commission membership. Now, I know there's some strong feelings around constitutional issues on this point. So I would invite anyone of the committee who wishes to speak on that. Councillor Mills?
Thank you very much, Chair. So the report that we've got in front of us, it does admit that the original interpretation of the Constitution was that chairs should come from OSC. It says that the nomination process was conducted on that basis. It says the interpretation has now changed. It says a constitutional report is still required because the wording is ambiguous. And therefore, we are being asked to kind of rerun a process using different rules before those rules have been formally approved. So I guess I've got other questions as well, but my starting point is, why would we reopen appointments before that constitutional position has become settled and before members have seen the materials and the kind of the notes that underpin the revised interpretation? And people will have seen from my emails today that I have been requesting those for, I think, over a week now. So kind of why are we being asked to reopen appointments before the constitutional position has been settled and before we have seen the materials that underpin that new interpretation?
Thank you, Councillor Mills. Anybody else have anything they want to say in respect to that? Councillor Crime?
Yeah, just leading from what Councillor Mills said, I think it was always the intention that, and Section 2.2 of the OSC procedures in the Constitution make it quite clear that actually the chairs of commissions should sit on OSC. And the reason for that was to bring the commissions closer to the main Overview and Scrutiny Commission, and so there wasn't a disconnect around that as well. And I think that's really, really important, because actually our purview and our oversight at OSC is anything across the council we feel is important enough to actually impact our residents and services around that. And if you have a member of a commission who does not sit at OSC, that is a big disadvantage to that commission. And I would argue that the Housing Scrutiny Commission is probably one of the most important ones, given that this joint administration has now got housing front and centre and improving the housing department as one of its main objectives. I think having a chair that does not sit on this committee here is really putting it at a disadvantage as well. And I know we're going to come to the work plan later, but there will always be housing issues that come to Overview scrutiny. And actually, it's really, really important that, and other things from all the other commissions, and it's really important that any commission chair sits on this committee. And that's why that's in the Constitution like that. It isn't really that ambiguous. I think the only reason we're looking at this today is about proportionality. And I think we've got to be totally honest about this. This is a little bit of gerrymandering in the fact that we all know recent decisions around administration meant that a certain party could have a chair of OSC and 2 commissions, but proportionality showed there are only 2 places on OSC, and this is trying to circumnavigate that. And I think we have to be really clear about that as well.
Yeah. Thank you, Councillor King.
Yeah, thank you. It was really to draw on a point that Councillor Mills also mentioned. I would really like to understand that we have requested legal advice, and therefore it would be really helpful to understand if legal advice on this has been taken, and if it has been taken, why it hasn't been shared with the whole committee. The question just simply hasn't been answered at this point, and I think a number of questions are being asked about this constitutionally, very much for, we understand the intent of what was written into the Constitution, because it is what we wanted to achieve through linking scrutiny commissions to Overview and Scrutiny. So it feels very difficult to move on from this point until we have an understanding of what the legal advice has been in this space.
Thank you, Councillor King. Anybody else? Councillor Cox.
So just a chance. I mean, I believe we have. We have had fairly definitive guidance from the monitoring officer regarding this issue. So the statement that the chair must come from the OSC, they have claimed, as you've spoken about, unless the proportionality comes into it. So they've sort of definitively answered this no. And their legal officers have reviewed it. So you've talked about legal guidance, but it has been reviewed by the legal officers at the council. So I'm not aware that there's an issue to debate.
But yes, I'm inclined to agree that the monitoring officer did set out a full email with reasons as to why it is perfectly constitutional to have a chair who is not a member of OSC. Sorry, but just to give additional information, if Councillor Benavides is appointed today, she will be a reserve for OSC as well. So there will be opportunities for her to come to the committee. Councillor Mills.
Yeah, I suppose I've got 3 quick points. And actually, we can see on the audit trail that legal advice wasn't sought. So one of my questions is why we wrote this report before legal advice was sought. And that still has not been cleared up in the emails that we have received today. And I suppose at the crux of this, are we being asked to reconsider these appointments because membership has changed, or because officers have changed their interpretation of Procedure Rule 2.2, and that has still not been cleared up. And if officers hadn't reinterpreted Procedure Rule 2.2, would we be asked this evening to make these changes? I don't think we would be.
Councillor?
Yeah, just a correction, Chair. Under reserves of the European Scrutiny Committee, Councillor Benby, this is not a reserve, and it's not part of the new changes to the committee membership on supplemental agenda number 1 either. So this committee has not agreed that.
No, not formally, but that's the intention. So just giving wider context in respect of just giving wider context in respect of your previous question. Oh, Everton.
A request for change in membership of the Scrutiny Committee has been made because of the 5 clear day rule that applies to changes in membership. That doesn't take effect until Thursday, which is.
And is it subject to calling?
No, it's just part of the membership.
Okay, that's from my perspective, I'm content that this is legal and constitutional. So I don't think there is any more we need to do on this matter except do the vote. So we'll move to that.
Should I propose something alternative then? It's not clear to me why we can't defer. So could I propose that we do defer until the kind of remaining queries and remaining documentation has been provided to members, and defer until the Constitutional Steering Panel has met and cleared up these questions in terms of the ambiguities in the Constitution, which is the wording that officers have used.
Are you making a formal proposal?
Yes.
Who's your seconder?
I'll second
that. Councillor Ryan is seconding. Okay. Those in favour of deferring? And those against? So the matter won't be deferred. Councillor Mills?
Can I propose some additional recommendations on the report then?
What's your recommendation?
Quite lengthy. So we note that the report of the head of scrutiny and the subsequent correspondence between members and officers regarding the interpretation of overview and scrutiny procedure rule 2.2. So that's just what people have seen today. Notes that officers have confirmed the current drafting of the Constitution requires clarification and that proposed amendments will be brought forward to Constitutional Steering Panel in due course. Notes that appointments made on the 28th of May 2026 were conducted on the basis of the interpretation then applied by officers and members, namely that Scrutiny Commission chairs should be drawn from the membership of Overview and Scrutiny Commission. Notes that members have raised concerns regarding the constitutional basis for departing from the interpretation applied on the 28th of May, the intended purpose and constitutional history of Procedure Rule 2.2, the absence of any published constitutional analysis supporting the revised interpretation, the absence of the material underpinning the review referred to in paragraph 6 of the report, considers that it would be inappropriate to alter the basis on which Scrutiny Commission appointments were made on the 28th of May before the Constitutional Steering Panel has considered the constitutional position. Any necessary constitutional amendments have been considered by Council Assembly, and members have been provided with the information and documentation requested in relation to the review which led to the revised interpretation. Request that officers circulate to all members of the committee any written, legal, constitutional or governance advice obtained in relation to the review, any officer briefing notes, reports, memoranda or background papers prepared as part of that review, any constitutional analysis relied upon in reaching the revised interpretation, The reports, minutes and supporting documentation associated with the introduction of Procedure Rule 2.2 and any other material relied upon by officers, in concluding that the Scrutiny Commission chairs need not be members of the Overview and Scrutiny Committee. Resolves that pending consideration of the matter by the Constitutional Steering Panel and any consequential constitutional amendments, the committee will continue to apply the interpretation made, which the appointment of the 28th of May was made, namely that Scrutiny Commission chairs should be drawn from the membership of Overview and Scrutiny Commission, and accordingly declines to approve the recommendations contained within the report and requests that a further report be submitted following completion of the actions set out above. Now, I would have thought on that final point, and there's not going to be agreement on that, so I would take that out if it meant that there could be agreement on the previous points, which I think are just a matter of fact.
Right, so those in favour of that recommendation? And those against? So that recommendation is not carried. Councillor Mills?
Thank you, Chair. And this is a point that you know that I raised when we were all on scrutiny training earlier in the week. So the Southwark Council Constitution is really clear about the importance of minority voice being heard. So can I ask that the proposed recommendation that doesn't have majority support is formally recorded as a minority recommendation of the OSC committee?
We'll need to take some advice on that.
What the members can do is request that they vote in favour of the amendment is recorded. So I would recommend they do it through that process.
So just confirming we are not allowed to make a minority recommendation.
No, what I'm saying is if you want your recommendation to be recorded in the minutes, if you request that your vote for the recommendation is included in minutes, then it can be included.
So that should happen anyway, but what I'm asking is that it's recorded as a minority recommendation.
It will only happen if you request for it to be recorded.
Okay.
Does that need a vote, or is that can be accepted?
Just the member who indicates they wish for it to be recorded in minutes.
Right.
It's helpful if those members who wish for that to happen indicate.
Okay, let's vote in.
Yeah, to be formally recorded as a minority recommendation and recorded in the minutes as such.
Right. Okay, so now we move on to nominations to the position of Chair of Housing Scrutiny Commission. Are there any nominations from the floor? Councillor Mills.
I would like to nominate Councillor Cryan, based on the clear interpretation of our current constitution. She's the only member who can do what we've all said is really important and bring the commission round the table here. So I want to nominate Councillor Cryan.
Thank you. Someone nominate second?
I'll second that.
Councillor King. Thank you. There's no other nominations? Right, we'll move to the vote. So, right, so firstly, Councillor Benavides. Those in favour? Those against? It is agreed that Councillor Ben.
It'd be nice if we even allowed the
So
vote.
apologies. So we move to Councillor Cryan. Those in favour? And those against? Therefore, it is agreed that Councillor Benavides is appointed Chair of the Commission. So we now move to the post of Vice Chair. Are there any nominations from the floor for Vice Chair? Councillor Mills?
I will nominate Councillor Crone.
Can I have a second? Councillor King? So firstly, Councillor Mitchell. Those in favour? And those against? And then Councillor Cryan, those in favour? And those against? Thank you. Therefore, it is agreed that Councillor Mitchell is appointed Vice Chair of the Housing Scrutiny Commission. Right. We now move to item 8. So for this item, committee members are invited to consider potential scrutiny topics for inclusion in the Overview and Scrutiny Committee Commission work programmes for the 2026-27 municipal year. As you will have seen from the papers, there's a view that we will agree that work programme at the October meetings of OSC, and those reasons are set out in the report. Additionally, we asked to note the proposed Scrutiny Committee Commission remits, which are Appendix 1 of the report, and make any amendments as appropriate. So the way I'd like to conduct the conversation around this is very much a sort of gathering of ideas, a pooling of ideas that we can take away over the summer. In addition, have meetings with the scrutiny chairs to further that discussion so that we can prepare that work programme to sign off at the October meeting. Now, I'm consciously aware that's quite a period, but it does make sense in terms of, as the borough plan is not yet finalised, that the topics that we scrutinise should be linked to the overall plan and strategic priorities of the council. That said, we can certainly still have topics for scrutiny at the October meeting, but the formal plan is adopted then moving forward. So that's the intention, and I have had meetings with the Green Group and representatives from the Labour Group to sort of get initial ideas of topics. I very much want this to be a collaborative process, and that we get a broad range of topics to scrutinise for the 26-27 plan, reflect residents' concerns, and the strategic plan of the council. So that's the intention. Councillor Mills.
Yeah, I certainly think we should put together some ideas this evening. That's very welcome. However, I do think we should agree a draft plan this evening. I don't think it is okay for us to have a 12-month scrutiny committee and not have a plan for 5 months of it. I think that's totally unacceptable to residents. We all heard really, really clearly on our scrutiny training, and obviously some of us, I guess, have been around this table before many times, and we know that the work plan can be flexible. So we can take things off, we can put things on, but I really don't think it is acceptable in terms of good governance for us not to agree, even if it's just a few key areas of priority this evening for a draft plan. And then, of course, we can add and amend it in the autumn. But I think 5 months out of 12 not having a plan is not okay.
Any additional statements?
Yeah,
Councillor Coates?
yeah. Thank you. I 100% agree with that point that he's made. I mean, 5 months without an agreed plan actually isn't acceptable. And you talked about, you want it to reflect the council plan, which is fair enough. But we all know what our residents' concerns are. We can talk right now about the areas that will be concerned, so we can start formulating a plan. And as Vicky said, what we can do is, adjust and amend in autumn if need be, but I think we need a plan to start working on.
Thank you, Councillor Cozy. Councillor Croy?
Yeah, I'm also concerned because as soon as we get into November, which is probably when the work plan starts, that's when we start scrutinising the budget, and that's what takes over all the opening scrutiny meetings for November, December and January. So then that just leaves really March for doing any other scrutiny. In that respect, to do any real meaningful scrutiny. And therefore, I think not having something on a work plan now, which, as we said, can be flexible. I think the scrutiny training was quite clear it can be flexible, and we can add and flex things up as and when we need to. And also bearing in mind that things happen throughout the year and things get pushed off the work plan because emergencies happen as well. We could be in a situation where we don't do any scrutiny of the council plan at all, because one, we've waited too long. Two, we are quite rightly looking at the budget. And then thirdly, something could happen that actually knocks all of that off. So we could have potentially just one scrutiny meeting that's looking at the council plan, something in the council plan. And I don't think that serves our residents well at all. It doesn't pick up the things that our residents are concerned about. So I think to be a really effective and really meaningful scrutiny commission, I think we need to hit the ground running and start properly scrutinising things at the next meeting.
Just briefly in response to that, obviously we are going to have things to scrutinise at the October meeting. No one is suggesting there be nothing on that agenda, just to make that point. The key thing is about approving the formal work plan of 26-27. So I certainly don't, I agree, it's not good for residents not to have it be scrutinising anything, and that is not the intention. Councillor Williams?
I'm not going to repeat everything that's just gone, but I'm going to add, I call into question officers' integrity in allowing this to happen.
I don't think that's particularly a helpful comment. There's no...
It's my comment, Chair.
When I'm speaking, you do not. I don't think it is helpful to sort of criticise the integrity of officers. I have seen no evidence to suggest that. This is about being practical and adding value for residents by getting a work plan together that reflects the council's priorities and strategic direction. Nothing more. Councillor Peters.
I'm generally curious as to what value this conversation has added. I think we can have a substantive conversation about areas of priority. Maybe we get to the end of that conversation and we have a broad consensus and we could agree a work plan, but I feel like this is just arguing over nothing. I move that we move to a substantive discussion of the areas of concern.
Thank you, Councillor Peters. I think that is a good idea. I hear people's concerns and they're noted, but what I want to do now is move the conversation on to talk about specific areas that we'd like to see in the work plan. And as I say, can use the summer to further that and have more conversations, work in a collaborative manner. Councillor Mills.
Okay, so I think that one substantive item we do need to look at is the council plan. We did meet relatively recently, and I suggested that we invited Councillor McCash and Councillor Chamberlain to this meeting, and to run through their intentions for the council plan. That would have been a really, really good opportunity to do pre-scrutiny, which we both agreed was really, really important. So I don't know whether you are able to update us on why they chose not to come, but what conversations you've had to allow us to do pre-scrutiny on the council plan. It's obviously very delayed now. I think the intention is, usually it would be published by now and out for consultation. But obviously the coalition have decided just to produce a statement, I think, in July. So maybe there is still opportunity for pre-scrutiny. So I think that should be on our agenda for the October meeting. But I think it would be useful to understand your conversations with the administration about how that can be a useful piece of scrutiny, or have we already missed the boat?
My conversations with them is we should do this at the right juncture where there's something properly to scrutinise and add value. And that remains my position. Councillor Crone?
Yeah, in terms of October's meeting, I think it could be quite helpful to do some pre-scrutiny on community councils. There could be budget implications on those. It'd be, I think this committee could add value to shaping those and what they could look like. And I think that's something that hopefully by October there should be some starting of plans on this. I think that could be a good item for October.
Yes, I would agree, and Councillor Mills and I discussed that. Councillor Cox?
I think it'd be useful for us to look at the fair funding review. So obviously, Labour government has changed their fair funding review, resulting in a vastly reduced budget for Southwark Council. So I think a minimum of 85 million over the next 4 years. So just analysing how that's going to impact council and services.
Thank you, Councillor Cox. Councillor Mills?
Yeah, I think maybe if we're going, obviously we would, we will do a financial piece on the budget early next year. But, we had the conversation about the fact that once the draft council budget goes to cabinet in December, quite often at that point, it's very difficult to make substantive changes. So, I mean, I'm happy to hear the fair funding review all over again, but I don't know whether it might be more useful to look at the medium-term financial strategy, to understand our projected budget gaps, to understand the big major financial risks ahead of the December draft budget. And I don't know whether specifically, I mean, it's a long time since I was finance lead, but whether the pressure points around particularly around temporary accommodation, adult social care, SEND, could form part of that discussion, and if there are wider risks that could be discussed as part of that kind of budget piece.
Councillor Fowler?
I think also just to build on what Councillor Mills was saying, and also what Councillor Cox was saying, was also having an overview on insourcing. So obviously, sending these other contract provisions, their contract expiring coming up, and I think having an overview of that on how we can get a grip on those things would be really good.
Thank you. And Councillor King?
Thank you. Sorry to take us back a step, but I was keen to come in, Councillor McMillan, when you responded to Councillor Mills's point about your discussions with the coalition. I absolutely see the point you're making, that you want to scrutinise the new council plan at the point that it is effective to do so. But I was just wondering if you could give me a better sense of when that timing will be in terms of your discussions, both with the leader and the deputy leader, and whether you can give me some reassurance that that will still be pre-scrutiny of the council plan, or whether it will be after the event.
Thank you, Councillor King. I don't have a precise date for you, but wouldn't be assured that it's certainly my intention to have as much pre-scrutiny as possible. And in the discussions I have with the leader and the deputy leader, that will be a focus.
Could I ask a quick follow-up?
Follow-up, yes.
Yeah, given that, I wonder whether it would be helpful for us to schedule it for the next meeting, even if in the event that it's not ready to do pre-scrutiny of the council delivery plan at that stage, we then push it back, but it is scheduled for our next meeting of overview and scrutiny so that we don't lose that opportunity.
I'll certainly take that away. As I say, at the moment, we're sort of getting ideas and brainstorming, and then something will be firmed up, but I value the contribution. Councillor Crone?
Yeah, and when we're looking at the fair funding and the budget, and that can also add the housing revenue account, because of and where we are on the recovery plan, and are we ready to go into stage 2 of that recovery plan? And can I just seek a point of clarification on the SEND and insourcing? Was that the SEND transport?
No, the rest wouldn't be insourced.
Is it the SEND transport policy? Because if it is, Councillor McCash delegated authority to the head of adult services, children and adults to sign that off this week.
I would like to apologise in using SEND as an example. It wasn't a contract I had particularly in mind. I was thinking back to what Councillor Mills was saying on the delivery of that. So apologies.
No worries, that's fine. It was just a point of clarification.
No, thank you for that.
Councillor Penny?
Yeah, in terms of items that we could look at on the work programme, one could be refurbish versus demolish. So looking at the important topic of housing, with a particular focus on places like Aylesbury and Marie Curie.
Thank you, Councillor Penny. And I think from my side, I think we'll have the anniversary coming up of the housing regulators report soon. It'd be good to have a sort of update on that and what the changes have been made. Councillor?
Yeah, a linked point to that. Obviously, all of the major regen reports have been pulled from cabinet, and they've been pulled entirely from the forward plan. And I think that might be quite worrying for the residents who have gone through the consultation process for those, because there's not been any communication about that decision that happened last week. So maybe linked to what Councillor Penny was saying, it would be good to have the regen lead here at the October meeting to understand what the current thinking is, and also how the community are going to be informed and consulted about the changes in plans or about a prolonged pause. And I think that, you know, if I saw those reports and if I lived on those estates, I think I would be left very worried after last week's decision.
Thank you. Any more from the side? Councillor Peters?
Hi, yes, I think something that might be of use looking at budgetary questions as well, just thinking about procurement more generally, because you get anecdotally, you know, a fair amount about, you know, various pieces of work that have been padded in various ways, and, you know, there could be quite a lot of capacity for saving the council money if we look at procurement, contract management, things of that nature.
Thank you. Councillor King?
Thank you. Just to add, I think the suggestion around regeneration is a really good one. I think Councillor Penny and Mills have set out some of the key reasons why it's important that the Aylesbury regen and refurb comes to this meeting. I would also like to extend it to all estate regeneration that's underway in the borough. There are estate regenerations projects underway on the Ledbury and the Tustin, and I think a discussion about the progress on those residents' expectations for the future would be really powerful as part of that discussion. And I would also like to go as far as to suggest that, as has been the case at previous overview and scrutiny meetings, that we ask if some of those tenants and residents associations and residents could attend the meetings, so that we can take their feedback and advice in terms of how we assess policy changes.
No, I think that's a very important point. I think we should get resident voice as much as we possibly can. And actually, as part of sort of developing our work plan, we want to reach out to the public. I think there is a way of doing that, but we could probably do a lot more to publicise that, to get ideas from our residents on what we should be scrutinising. Very much. Councillor Mills?
Thank you, Chair. I've got a few more suggestions, and then I also did a quick scan of the last committee meeting of ASK and the last committee meeting of the commissions. I don't know if people did similar, just to kind of pick up on things that didn't get finished. But kind of like in terms of my things first, I know we talked a little bit about some of the comments that have been made around SIL redistribution, and that was also an item that wasn't quite finished at the last OSC meeting before the elections. It might be that could fit into a kind of wider community governance piece linked to the community council stuff. So that's one thing. Specifically on SEND, I don't know whether it is for the education committee, but I think our safety valve agreement with the Department of Education does need looking at. And then I think there's some useful pre-scrutiny around what the government's proposals for SEND mean for Southwark, but it might be that is a better fit for the education committee. Also, I think kind of benchmarking children's early intervention, our offer versus other boroughs, and there's been quite a lot of money out of that service. So I think it might be timely to look at that. And then finally, I mean, I very passionately believe that the the age for transition out of CAMS to adult mental health services should be a kind of between the ages of 18 and 24, you should do it when it's right for you. And I'd be really interested in looking at that, because we know that kind of mental health for young people remains a big challenge in the borough.
Thank you. Councillor Peters?
Yeah. Yeah, thank you for that. So something I'm particularly interested in looking at within the health and, well, we've decided names with health, etc. Scrutiny Commission is issue of, and I heard chats to the executive members in charge of social care and community safety, and just issues around drug use, particularly as it relates to vulnerable populations. I think it ties into Councillor Mills' piece about young adults, actually young adults' mental health. Just about how we can get more joined up thinking about like vulnerable youth and drug use and rough sleep and all sorts of associated things, and then obviously has implications on community safety as well. So that's a piece I'd particularly like to look at from my commission. Just mention it here.
Thank you. And actually, I'm keen for us to look at some of the things around temporary accommodation and homelessness actually as well.
Yeah.
Councillor Cox, did you have anything else?
No, I think that actually covered it. Yeah.
Councillor Coton?
Thank you. I'm really interested in how far the integrated neighbourhood work, the health aspect, how far it's going. So I would like it, I'm not sure whether health want to look at that, but it'd be good to understand their approach, because obviously, as we heard today, they're working with the integrated health model and see how connected it is. So it'd be really good to understand or have a kind of an early start to getting the ideas and trying to kind of shape that new neighbourhood model. But if we can come here, that'd be great.
Councillor.
Thank you. The committee, and I think also the commission, has previously looked in quite a lot of detail about need for school closures, particularly at primary level, and I think it would be timely for overview and scrutiny and potentially a commission to be looking at longer term impacts on secondary schools. So I think it would be good to factor that in. I also think it would be useful to also have a look at how what I would describe as the primary school estate was being used to the benefit of residents going forward. So I suppose it's a look back on the implications of what has previously happened, but also looking forward.
Councillor Penny?
Yeah, I just wanted to briefly speak about some of these points we've just discussed in the context of local economy and education, and starting to think about which comes to us and which goes to subcommittees. So something to do with like secondary school closures, for example. I personally think that would work well in the education.
I'm going for
And that would be a discussion we'll have. What's better for a commission and what is better to come to us, depending on the issue. I know the general view is as much as linked to a specialism should be with the specialist area, but there may be some issues that are such profound importance that they need to come up to the parent committee. Councillor Mills?
Yeah, just on the closures, that was like unfinished work for the Education Commission last year, and I think particularly secondary would be helpful. And just to note, that is another decision that kind of the administration has chosen to give over to officers. And I have to say, it's been, it came to the commission because it was such an issue of local community concern. So I kind of think, there needs to be, if it goes to the commission, some really tough questions asked about how we've ended up in a position where we are not getting members to lead on that. Because, having been a councillor for 16 years, having seen schools open and then close, it has always been a matter that members have led on. Just in terms of other things that were a little bit unfinished from some of the commissions, I don't know this well enough, but I understand from the former chair of the Environment Commission that the Cleaner Southwark pilots, they hadn't quite been able to do a piece of work on that because the pilots weren't in a good enough place, and there had been commitments around following up on those pilot programs. So that might be more appropriate for environment, but looking through the minutes, that was something that was kind of very obviously promised and hasn't quite been able to be delivered on because of timing. I suppose the other possible thing for environment, especially if we're thinking about insourcing, is that I think the Veolia contract will be coming up. And actually, if you want to pre-scrutinise that, that would be, a good thing to do sooner rather than later.
Did anyone have any thoughts? Councillor Crine?
Yeah, because I'm the only member of the Housing Scrutiny Commission here, I think, there needs to be some housing, whether it comes to this commission or to the Housing Scrutiny Commission, but I think the repairs improvement plan and how that's going does need to be scrutinised this year, and also the voice turnaround as well around that. And I think those are two things that either come to this commission, or if not this commission, definitely need to go to the Housing Commission. And I absolutely agree with you on TA as well. That does need, it's a big budgetary pressure, but it's also, the numbers of people in TA and the cost of TA is increasing as well.
Thank you. And also, I'd like to see something around sort of regeneration of high streets, etc., as well to scrutiny, particularly the Renew the Blue campaign in Bermondsey, which would be a good focal point for that. Councillor Mills?
Yeah, so I think some of the things on housing might well be best placed at the Housing Commission, but TA might be the thing that should come here, and it does have real budgetary implications. It has big implications for kind of children and for adult social care, and big impacts on health as well. So there might be quite a nice kind of cross-cutting kind of piece that we could do on TA here at OSC, if we decide that some of the other housing things are more appropriate for housing.
Thank you. Right, well, unless anyone's got any other burning ideas, I suggest that we sort of draw this discussion to a close, but obviously the conversations continue outside of this room over the summer. But I feel there's some brilliant ideas there for scrutiny, and actually some ideas for the October meeting as well, so that we are scrutinising topics. So yes, look forward to more discussions over the summer. So I'll draw that part of the discussion to a close, but we do have to do the voting on the main change. Yeah. So firstly, before we move on to the next item, we just need to confirm the OSC and Commission remits as outlined, or amended if there's any amendments that want to come. Councillor Mills?
I don't have particularly strong views on this, but it might be helpful to line up the remits with cabinet member responsibilities, and I guess it was just asking for assurance that that is what the intention is with the changes. I really don't have strong views. We have 4 commissions. We want them to do kind of equal parts of stuff, and we want them all to do important scrutiny. But that, I guess I'm trying to understand why, because community safety keeps getting passed around. Yeah. And is it in the right place with what we're proposing? Does it line up with cabinet member responsibilities?
We'll come back to you on an answer of that, because I don't have the response exactly for you now. Councillor Mills?
And then I might be wrong, I only read it, but because the coalition has chosen to call the Regen lead Public Works, and the way that Public Works is phrased in the remit, it does almost feel that non-publicly funded regeneration is not very clearly in our remit as OSC, and I absolutely think it should be, but maybe I'm overthinking that. So I think it needs to be really, really clear. Big strategic regeneration absolutely does, should be something that we look at as OSC, whatever our kind of differing views on how it should be done.
Everton, do you want to come in on that point?
If I could just try and clarify, Chair, that the asking the Commission remits are based on the executive portfolios as they've been presented. But what you'll find is that there are areas within one executive remit that covers a number of different commissions. So what we've tried to do is to enable you to work out what issues should go to what commission. We've literally taken the portfolio descriptions and chopped them up so that they fit with each commission as appropriate. That's all it is. We haven't changed any words. They're all from the actual executive portfolio that appear in the council constitution. The issue about deciding whether or not something should sit with one commission or another is purely whether or not you think something like marinas should sit with environment or should sit with OSC, because some of the issues which appear in different commissions were done via conversations with the previous chair of OSC.
Right.
And it doesn't cover everything that Overview and Scrutiny Committee can look at. It's just a starting point to kind of say, this is how the council will set itself up. This is how Overview and Scrutiny Committee and its commissions may wish to set itself up to ensure that they are aware of the issues that they may want to cover.
Okay, so in terms of what we have to do now, though, is to either approve those remits or amend them if anyone wants to amend.
That's correct. I mean, it's just an officer staff at trying to support issues within their respective commission areas.
Okay. So has anyone got any specific amendments that they want to make to the remits?
I've got a question.
Well, I just want to work out if there's any amendments, and happy to ask questions. Is there any specific amendments? Okay, no. So what's your question?
So it feels like community safety is the thing that's being pushed around. And it would be good to understand, say, over the course of the last 4 years, or if you can't go back 4 years, the last 2, how many substantial kind of scrutiny items related to community safety have been taken. Because my concern is, by the fact it's being shunted around, actually what I think happens is that very few substantive items on community safety are being taken by any commission.
I mean, what the community safety aspect really relates to is the crime and disorder responsibility that the council has. Now, Overview and Scrutiny Committee has a specific responsibility to look at crime and disorder. Now, we can look at it itself, or we can delegate it to one of the commissions. There have been periods where it's sat with the Overview and Scrutiny Committee. There have been periods where it's sat with one of the commissions. And depending on which commission they delegate it to, that commission ends up with the community safety portfolio. So whereas they agree that the Health Commission, Health and Community Safety, when there was agreeing where crime and disorder goes, that went to Health and Community Safety.
So the key thing really is making sure it's on the agenda somewhere, isn't it? So it could come to us or one of the committees.
Now, part of that crime and disorder function is requires the Overview and Scrutiny Committee function to look at the community safety partnership, which is something which each council is required to have. It's like a 3-year plan, which in the first year they agree what the council priorities are in relation to crime and disorder and community safety. And that gets agreed by the community safety partnership, which is a body of the different partners, the police, council, NHS, and they operate on their own, but they do feed into the scrutiny function via the crime and disorder community safety process.
Okay. Does that answer your question?
It does, but I do think that this brings us back to the issue of work plan and work planning, and also the absence of a council plan. Right. We are, 6-7 weeks after the election. Right. We should have the council plan here this evening to scrutinise. No, let me.
No. When I speak, you stop. I think we're going off topic now. We're talking about the
if you let me
remits.
finish, then you might realise whether
Okay,
it's
as
on
long as
top or
it's a
not.
pertinent point, then
Yes.
that's fine.
So we had a really good discussion then about the items that we wanted on the work plan, and then you closed it down. Actually, I do think we should have gone with what
To
councillor.
interject there, I did not
I'm
close
getting
anything
there.
down.
but
No, no, no.
you're
Well, yes, because you made some false statements. So just be, I did not close anything
don't
down.
know that until you let me finish.
Well, I heard what you said. You said I closed it down. I did not close it down.
So, if I can finish, Chair, Councillor Peters made the really good point, he said, why don't we get on with the discussion and see where it goes to? And actually, we had a good discussion. There were some really good items. We could have spent 10 more minutes planning where those things could go and planning what we wanted to do in October. And then we would be far better placed now to work out where community safety might get really good focus and attention. So I do think by closing down the last item, we have done a disservice to this conversation about where community safety will get good attention.
Well, thank you for your points, and that'll be taken away as part of the planning. Councillor Peters.
So I don't want to speak to the work programme generally. I can say that, having drawn, so to speak, the community safety portfolio, I do intend to take it seriously. I'm aware of the community safety plan, which I think is going to be finalised on 15th of July. And I do intend to bring that to the first screening commission now rescheduled for the end of July, specifically so that we can examine it. And as I mentioned, I do think there's an interesting integration that we can discuss between the health and social care and community safety elements. So I do intend, I intend to integrate it into how I operate that scrutiny commission. I don't intend to leave it by the way. So obviously, how this committee intends to take that.
Thank you, Councillor Cox.
Yeah, sorry, just to add to that. I mean, health, being part of health again makes logical sense to me, particularly in the light of things like addiction issues and so on. It doesn't feel like being shunted around. I think that's a logical place for it. It's reasonable to me.
So I think if there's not any I think there's no formal changes to be made to the remits by the sounds of it. So, and then, yes, Councillor.
Yeah, I had a suggestion and I was trying to read it to check whether it was coming. If community safety was to stay in health, I think the points made with health, the points made about kind of the impact on residents health-wise from feeling unsafe is quite a powerful one. But what I do think is then missing from the remit of health, community and safety, it feels to me that it needs to also take into account equalities on how residents are impacted by community safety differently across the borough. Mm-hmm. So I do think there is more thought that still needs to go into this, because I'm getting quizzical looks. So I was going to ask if someone wanted to ask whether I was making sense. At the moment, I understand the argument to have community safety and health together, but I think there is more missing therefore from the remit than is currently within that proposed remit.
Continue.
I mean, just to say something. That's it wasn't directly connected with what we've just been discussing. Just to point out, sometimes you have commissions which cover two areas, and as much as they may well be linkable, they're not necessarily created in that way to make them linkable. It just means a group of members can look at two different areas. So like health is health, community safety is community safety. That's a completely separate thing. Just like education and local economy are two distinct areas where you can draw links together, but that's not the reason why they're actually put together in that way. But the point I really want to make, Joe, is through this meeting, you've made a lot of suggestions, some of which are clear, some of which may need a bit more clarification. One of the challenges we have as officers is communicating that information to the executive members, to the senior officers. So one of the things I was going to ask, Chair, is that we can reserve the right to come back to you with request for some more information on the areas that you suggested. And one of the things we are seeking to do is, once we have your topics, your agreed topics, we'll then kind of like scope up the best ways to actually conduct a review on particular areas you suggested. But based on all of what you suggested, that there is a lot of work which you put out there, so you will need to prioritise that at your next meeting. And one of the plans and the reasons for asking for you to defer consideration is to allow us to consult with officers, to consult with executive members about the proposals, to get an understanding of whether or not it's a good time to look at the particular issues. We'll feed that back to yourselves as the committee, and you can then make an informed decision about what you're doing.
That doesn't stop the commissions from sort of getting on and meeting.
No, Chair.
It doesn't stop that. That's why I was a bit worried about it if we don't officially agree remits today that they can't get on with any work, but they can.
They can.
Okay. Councillor Coates?
Yeah, thank you. I mean, with the discussion about health and community safety, I kind of can see why they are put together, because obviously there is a kind of one of the determinants that you can bring it together. I think the aspect of inequality is very important. If you look at health, if you look at community safety, the inequalities in this borough is startling, and we can't forgo that. And I think we have to make it quite clear, actually, that is a pivotal point for us to investigate. So I would like, if possible, for us to add inequalities within that framework, within that commission, for us to really make sure that we're kind of driving deep into that area. I think my other question is to you, Councillor McGrain, and I think it goes from what Vicky mentioned about the work plans. Obviously, we've got a whole list of things we have suggested. What happens now? Are we waiting to October to then divvy out the various topics, or is that going to be done through the summer? Are we going to be consulted on this? What is the plan for that?
Yeah, no, as I indicated, there'll be conversations throughout the summer to get more ideas and start to finalise something ready to agree in October. That'll be conversations with yourselves of the Green Party, the Labour Party, and also with Scrutiny Commission chairs as well.
So that means by October, we'll have what you think is the final work plan coming into.
Yes, to approve at the October meeting.
Well, what you will have is a list of topics that have got through a kind of shortlisting process, which will be undertaken in consultation with the chairs. That will have a kind of like prioritisation template to ask members to think along a particular line. Like, is it strategic? Is it something that Scrutiny can add value to? Is it timely? And we need the time to discuss these issues with officers to work out, one, whether or not it should take place, and two, when it's best time to take place. And as cabinet members, you'll be aware that we approached you about a particular issue and kind of tried to establish with you when it would be a good time, because there'll be a time when it will be better than another time. So,
in my understanding, Everton's scrutiny team will be in touch with individuals with a sort of formal process to submit ideas.
Yes,
to help prioritisation.
That's correct. And the reason for that is so that we have information gathered in a uniform way that will be easy for officers as well as the chairs to kind of determine the value of that particular issue.
Yes. Right. I'm mindful of the time, so we've got another item to go. I think it's brief points. Councillor Crine?
So I think, given that we are going to defer until October for the final work plan, I think when will we agree what items we are going to also put on the agenda for October for scrutiny? Because we have had that conversation. We will be doing some scrutiny in October. So I suppose it's, as a committee, when do we agree? Because that's the next meeting, what we're going to be scrutinising.
I think it's formally for me to agree the agenda, which takes place in 6 weeks out.
Yes, there's an agenda planning process, and that will take place with the chair and the vice chair, and then look at the issues and discuss what we think should be on the agenda for October meeting. If I could just say about the inequalities point, I mean, equalities sits with the overall scrutiny committee. I mean, I'm sure there's a way of community safety looking at an equalities aspect, but if your intention was that equalities gets moved from the scrutiny committee to community safety, then it'd be good to have that clarified. It's one of the points that specifically in the Constitution that overview scrutiny committee equalities issues.
Councillor Mill?
Thank you. I welcome that I'm going to be consulted about the October agenda. I wasn't consulted about the agenda for today, so but I'm welcome that I'm going to be consulted about October. I'm conscious that this is our second meeting. Our first meeting was the 28th of May. So some of this kind of planning and engagement with cabinet members, it does feel like that should have already happened. And it's really clearly set
We're starting
out
to revisit.
in the
Councillor.
I'm
I
not
think-
re
I think we're starting to revisit
yeah,
other
absolutely.
topics. So I'm
honestly,
no,
all you've got to let somebody make a point.
no. If it's linked to the agenda
Yeah.
item, I'm happy to make
And I
a point.
can't
but I'm
get there
not- we're
because
not-
you keep talking over me.
We're not revisiting the agenda.
About
before it's
sharing.
discussed.
So if I could finish the point, I would really welcome that. So it is our second meeting. The scrutiny protocol is really clear about the expectations about how people engage with cabinet members. So I think that is important. And my suggestion would be that perhaps on email, we could pull together by the end of the kind of the council kind of summer, you know, so what is it like the 17th of July, that we commit to pull together the ideas that we've discussed this evening, and that we have a conversation on email about prioritisation of the things for the October meeting. I think if we don't put a date on it, the concern is that, Chair, you've said we'll do this over the summer, but I think that that's a bit too open-ended. I think it's reasonable to say, could we not pull together on email, my proposal is a kind of draft list of all the things that we've spoken about, and a prioritisation of those by the 17th of July.
That's the point that I made, that the scrutiny team will be in touch on that, with how each group prioritises what it wants on the agenda. So they will be in touch with a sort of process to do that.
By the 17th of July.
Well, I'm not giving a date on it. So as I say,
could you put a different date on it then?
no, we've said over the summer, and I'm not putting a set date on it. I think that's reasonable. But everybody will be consulted on, and we'll get a good agenda for October. Now, I think we need to move on to the next item. So now this is, so just to note that the remits are not formally adopted today. That's what I was hearing, that there'd be, people wanted to email further suggestions.
Yeah.
I thought it was changing remits, but is that not the case? Okay, so work plan, right, okay, so it won't change the remits, which is about the work plan.
Can I ask a question?
Yeah.
Because I thought we were talking about changing the remit.
Or adding things.
Yeah, we were.
Adding things. So my point about quality is its relationship to public health.
I
haven't actually, there was no firm proposal on the table at the moment, so I thought we weren't giving ourselves time to.
Which is why, yes, which is why I asked the question, can the Commission still continue with their work if the remits were formally?
I mean, they're broadly where they should be. There's some obvious portfolio responsibilities that sit within a particular commission. It is purely to signpost an issue to a commission. It's not a formal document, it's just a document which uses the executive portfolios to try and make sense of how where it will land within the commission. So the commissions can continue with their work. It was just if you're happy with where things sit at the moment, then that's where it's it. With regards to kind of like things of where community safety will sit, that's a bit of a bigger conversation, because overview screening committee agreed that the crime and disorder function, which is a statutory function, sits with the Health and Community Safety Screening Commission. So that's not based on the executive portfolio, that's based on a function which the overview screening committee are responsible to manage.
Okay. Councillor King, did you want to?
Yeah, I have honestly got a bit confused. So, for example, in the way it's currently set out at the moment, does that mean that the housing and the Health and Community Safety Commission would interview the borough commander as it currently is set out.
That's correct.
And that is a change from the previous, when the borough commander came to us.
Or
does it go to both of them?
Well, this is,
Can I just finish?
MI
Yeah, so we would still go to both.
okay, so what we're trying to asking members to try and avoid is duplication of
Yeah.
work and effort. If crime and disorder sits with the Health and Community Safety Scrutiny Commission, then it would be desirable that community safety issues are dealt with there. There has been requests for the borough commander to come to overview and scrutiny committee for whatever reason, and that's been accommodated. But what it does mean is an individual going to two places to talk about the same thing. What would be helpful is if, when you're thinking about an individual coming to two meetings, this is including executive members. One of the big complaints I've had is, I was just at overview scrutiny committee this week, and I've had to go to another commission to square, same thing, a couple of weeks later, trying to design it out of the process. But it doesn't mean that boss can't hear from the borough commander if you've got a reason for it.
I think it's not okay for us to have duplication unless something substantial comes up. I think that's not okay. And I do think that means that we should make a firm decision on rebits tonight. You know, I think kind of let's not make perfect the enemy of good, or the other way around. So I think we probably should. Otherwise, again, this is going to be another thing that drifts and prevents meaningful scrutiny happening.
I'm inclined to agree. I think that's the right decision. So can we all agree that we're accepting the remits as they are? Thank you. Right, so the final item, item 7A. This item has been circulated late to enable the committee to consider the renaming of the Health and Community Safety Scrutiny Commission. I'm just going to invite Councillor Peters, if he's happy, just to introduce the reasoning behind the suggested change of name.
Yes, it's well, I hope this one isn't controversial. It's simply that the Health and Community Safety Commission also includes adult social care. So adult social care, children's social care is going to have to sit with education and local economy. So I thought rather just have the total of the name be health, adult social care, and community safety. That just reflects the importance of adult social care. It's one of the biggest council budgetary items, and obviously very important for the community. I just don't want it to give the impression that it's not a priority. I think the acronym would be pronounced HASCAX, which is kind of pleasing. Yeah, as I said, relatively simple name change. I don't think it's anything substantive except to signal that adult social care is important.
Does anyone want to speak against that, or can we agree it? Agreed. There we go. It's an easy one. I'd also just want to invite members to consider whether any other commission name needs to be changed, if anyone wants to raise that. No? Excellent. So unless there's any AOP, oh, sorry, Councillor Mills.
Just a quick one, Chair. I know we spoke about the scrutiny protocol when we met, and obviously the things that Everton's raised this evening has made me think about that again. I think it would be helpful to understand from officers kind of what good practice would look like in terms of us delivering the bit of the scrutiny protocol that talks about relationships and meetings between members and commission members and cabinet members, because a huge amount of work went into that protocol, and I'm conscious that that is the thing that will allow us to do pre-scrutiny and will allow us to keep moving in terms of scrutiny.
Okay, Chair, so we piloted meetings between what was then cabinet members and scrutiny chairs early last year. Early in the municipal year. And The primary reason for that was for the Scrutiny Commission chairs to get an understanding of what the cabinet member priorities were, to get to build a picture of what might be good to look at. We then facilitated a second meeting later in the year, one to provide cabinet members with feedback on what the scrutiny had been looking at throughout the year, but also because there's the position in June with regards to whatever the cabinet member priorities are, and then by November things may have changed. So it was intentional for there to be 2 meetings a year. One, to have that initial discussion, and 2, to have a catch up, as well as to incorporate anything that may have come along during that period of time. Part of asking for a delay in the work programme is so that we can arrange those meetings again between what are now executive members and scrutiny chairs to keep that dialogue going. And because the executive members were so new, I mean, the other thing I'd say is we had annual council assembly on the 28th of May. We've got overview and scrutiny committee on the 22nd of June. That's not been a lot of time for anything to happen. With regards to this meeting taking place today, there was a question mark over whether or not it should take place in light of the newness of where the council found itself. We recognised the chair wanted to hold a meeting, so the meeting took place. I apologise that you wasn't part of that discussion. It just happened very quickly. The agenda for us went out, I think, on the 12th of June or something. That's like 2 weeks from the date of annual council assembly. Didn't know what the executive report was, the detail of that, so it's difficult to make any arrangements other than what you see here today.
So in terms of those chair or vice chair meetings with cabinet members, you are responsible for putting them in, and it's your intention to start putting them in from now going forward.
So here's the challenge. We can make the request. We contact the cabinet office at the time to find out what cabinet member availability was. We consulted with the chairs of the Scrutiny Commission at the time to ask them what their availability was. It wasn't possible in all cases to get that information. So not all meetings took place as we wanted. We're going to try again this time round to ensure that we do get those meetings in the calendars of both the executive members chairs, so that we can provide the committee with valid and meaningful information when you actually agree your work.
Right. I think that is the point.
Yeah, could I make a recommendation?
Yes.
I don't know then whether maybe as we could agree a recommendation this evening that we are very keen for those meetings to go ahead because of the kind of merits of them set out in the scrutiny protocol, and that we request that cabinet members or executive members agree to do them, if not before this round of meetings in June or July, that they took place before the next round in the autumn.
The intention is for them to happen before the end of July.
Oh, brilliant. Yeah, well, could we, I don't know whether we could just say that we would strongly welcome those happening, and we hope that executive members are amenable to them.
Can we agree that?
So that can be agreed. But we hope that they're arranged.
But it's part of the executive scrutiny protocol. It's what we tend to do. Whether or not they happen will not be down to the scrutiny team not trying to. You're the conduit. I mean, one of the challenges in the previous administration, because scrutiny chairs may have had relationships with their cabinet colleagues, sometimes discussions took place and it kind of like, what's the point of us having a meeting? We've really talked. For us, it's about having the scrutiny team in the room, capturing the information in a way that the chair doesn't have to then try and relay that back to us. We can interject and make points as necessary to ensure that the scrutiny aspect is being delivered in a way that's intended. That's our aim.
Good. Thank you very much, Everton. So, on that note, I think we can conclude the meeting now. Thank you.
Agree on the recommendation?
I think we were, yes.
Sorry, I just wanted to.
Just need to say it.
No. yes, we are agreeing the recommendations.
Thank you.
Good. Well, thanks very much, everybody, for attending and your contributions. Hope you're not too hot. And thank you for anyone watching online. Good night.